Dr. John Lipman is the founder and medical director of Atlanta Fibroid Center. He is a board-certified interventional radiologist who specializes in uterine fibroid embolization, also known as UFE. And Dr. Soyini Hawkins is the co-founder of Fibroid and Pelvic Wellness. She is a board-certified gynecologist who didn't know she had large fibroids, even though she was getting annual checkups. But pelvic pain made it very clear something was wrong. Welcome to the show, everyone. It's so good to have your expertise here and your candor. Yes. Because anyone who's dealt with fibroids knows we used to talk about it very privately, and now we have to have these conversations in a public space because they're driving women crazy. Regina, what's your experience been like?
Well, Portia, I really want to mention the quality of life issue. For me, I was diagnosed with fibroids probably at about 39 or 40. Mm-hmm. I chose at the time not to do anything about it. I don't know if psychologically you hope that they go away, but as I'm 55, approaching 56, my quality of life is challenged because at any given moment, I'm bleeding. I can bleed for days, profusely it feels, and I just want to figure out at this point, quality of life, what can I do? I was a little bit nervous about and did not want to do anything invasive, so I'm at a point now where I want to know what the options are.
Yeah. What may I ask, do you remember any of the options that your doctors have mentioned over the years?
Yes. You mentioned ablation. At one point, one of my doctors, my OBGYN, talked about ablations, but because I have so many fibroids, he suggested that I would have to have major surgery. I think, if I can recall, a C-section type incision.
And that really shuts down the conversation for most women.
Yeah,
like, you're not doing, look, we'll do that to bring humans in the world. But we're not doing this again if we don't have to, right?
Yes.
And Doc, I want to bring the two of you in, Dr. Lipman and Dr. Hawkins, because you both prefer and really advocate for minimally invasive procedures, which both of you say it's just not something that's discussed enough with women, particularly black women. Why is that?
Well, as you heard from Regina, she wasn't offered the non-surgical outpatient procedure that I perform, UFE. Ablation is fine to diminish flow for heavy bleeders, but it doesn't address the problem. The culprit is the fibroids. You need to address the fibroids, and UFE knocks out all the fibroids, whether you have 1 or 100, all of them outpatient, home the same day with a Band-Aid, even have children after.
Dr. Hawkins, I see you nodding your head.
Yeah.
This is personal for you, but also just the lack of conversation about options.
Minimally invasive options at that, because gone are the days where women have to have C-section type incisions. My patients say, I'm not taking a baby home. I don't want to get cut like that.
We're not doing that.
We're not doing that. Now we have these laparoscopic options, which is what I specialize in, where we can do keyhole incisions. I mean, as big as the nail bed that I have, where we can look in with a camera and give you options to either shrink the fibroids or actually remove the fibroids, and so much else. It all depends on just really the culmination of the symptoms you have and what you want your outcome to look like.
I want to get more into some of the treatment options a little bit later in the show from both of you, but just what do we know about fibroids and their origins, especially with black women?
We really don't know. We don't know where they come from, but they do grow with estrogen, and that's why they can grow rapidly during pregnancy and why they tend not to be an issue for most women once they get into menopause. Regina probably was hoping to go into menopause and be done with it. That's her story's common. A lot of women will just hold out because there was a study at the Mayo Clinic that looked at women. The average woman was waiting 3.5 years to get treated. A quarter of them waited over 5 years, and the reason was they didn't want surgery and they didn't know about UFE.
I want to, while we have this image up for our viewers, I feel as this dark mass
Right. This is an MRI picture from the side view. You can see that very large black circle. That's a big fibroid, bigger than a grapefruit. It's probably melon size.
And this is what your uterus should look like, right? This is, before you've had a baby or some months after you've had a baby, but this is how big it can get. Put in context what we're looking at here.
Well, these are pictures Dr. Hawkins can
Yeah.
explain.
Yeah.
This is what they look at laparoscopically.
Surgery. So this is a surgical picture, and it's showing, like you said, the normal uterus on the left, and then on the right, a big fibroid in the back of the uterus, so much so that you don't even see the back of the pelvis where the rectum is, where things kind of flow.
Oh, yeah, I see what you're saying in
Yeah, and you
context
can't even
now.
see the bladder.
Yeah.
So some patients will actually have symptoms that are like, I'm urinating all the time, I'm going to the bathroom and waking up 3 times in the middle of the night, or I'm not able to use the restroom well, or intimacy is uncomfortable,
Yeah.
and that's because of how much space is taking up there.
Yeah, we're going to pause right here, and I know when we come back, we're going to pick up where you wanted to, you were leaving off there, because there's just it's so complicated, and there's so many, and sometimes they come back, sometimes they just never are a problem. Conversation about this issue of fibroids continues, and then you're also going to meet Tony. Tony's going to join the conversation because her fibroids were discovered when she was pregnant. And the story that follows is absolutely incredible. She's going to join the conversation. More after the break.
I didn't know I had fibroids. I didn't even know anything about it, like much about it. When I found out I was pregnant last year in September, going to my first doctor's appointment, that's when it was discovered. And my doctor, my OBGYN at the time, she had let me know that I had one big fibroid sitting on the top of my uterus, and then 2 big ones on the side.
And I just want to point out to our guests, because for some it's been a minute since we've looked at an ultrasound, right? We're not the pros. We've got the docs here with us. And I should say neither Dr. Lipman or Dr. Hawkins or your physicians. But this is when you first saw your baby and the other company
Yeah,
in your uterus?
Yeah, yes.
Inside or outside?
Inside. So my OBGYN, she had expressed to me that the further along I get, they were going to monitor my fibroids because I might have to have a C-section. But I didn't know like what could eventually happen with me carrying my child and having fibroids. So I went to Google, which I guess you shouldn't do.
Oh, child, look, pause. Will you tell everybody right now, stop looking on the internet
Right.
for the options. What?
And Google kind of scared me. And when I brought what I found on Google to my doctor, she told me to stay off of Google and WebMD.
So, and just to make sure the lawyers are okay. Not that we're saying there's anything wrong with WebMD or Google, but you start doing a deep dive on things that
Yeah.
we don't know anything about. You leave the pros for that.
Yeah.
But let's talk about what ended up happening during your pregnancy.
So maybe a month or 2 into my pregnancy, I started to have severe pain in my abdominal area, my pelvic area, and the pain turned into bleeding. At first, the bleeding was just light with little to minimal clotting, and when I discussed that with my doctor had told me not to worry about it. It's the fibroids, and this is what happens because of where the fibroids are located and how
And
big
had you
they
not,
are.
and pardon the interruption, but did you have particularly heavy periods before you got
No.
pregnant? There was no pain. There was nothing that
No.
gave you a clue.
Nothing.
Tell me what ultimately happened.
So I end up losing my child this year. I had to go to the hospital because I was in severe pain around Christmas. And I was trying to deal with it on my own. I thought that I could push through it. And I ended up calling my doctor, letting her know what was going on, and I was told to go to labor and delivery. And when I went there, they let me know that it's a possibility that my fibroids were degenerating. And when that happens, it's really nothing that you can do about it. They can give you some medicine that can help you alleviate the pain for a little bit, but after that, it's nothing they can do. I would have to go through.
So you ended up losing this beautiful baby, and you have one photo that you shared with us because you want women to understand that it is okay to honor the babies that we lose.
Yes.
And so we honor the baby you lost.
Yes.
baby Kendrick.
Yes.
And I'm going to let you just be in this moment, because I also know that the two of this is what you see. This is, I hate to say the worst case scenario, but this happens.
Yes, indeed. I mean, fibroids can interfere with any part of the reproductive pathway from fertilization all the way to delivery. So they can cause lots of problems, and that's what both of us see constantly.
Unfortunately, and a lot of times it depends on where the fibroids are. To your point, usually the ones that we think would be most problematic in pregnancy are the ones that are in the cavity, that the patient has been bleeding heavy, and maybe we had a clue that this might impact it. But when fibroids are on the outside in the muscle, as that massive hormonal change our bodies are going through in pregnancy happens, they can start to grow, and they can outgrow their blood supply and start to what we call necrose. And that sounds like what was happening to you. So you kind of had, unfortunately, a double whammy there with the fibroid outgrowing itself.
So, I mean, there's obviously, we would never ask you to, be look back at her particular situation without knowing the details, but what do you want women to know about how important it is to be an informed patient?
Well, absolutely. You're the CEO of your own body. You know your body better than anybody else. So, if you've got to kind of look and see. She wasn't having any of the symptoms. The fibroids grew rapidly.
Right, that feels like the hardest part of
that
it
is
not
the hardest
having a
part.
sign.
But in general, fibroids cause their problems because they're like rock hard, and they'll cause their problems based on location in the uterus, like Dr. Hawkins mentioned. Those along the lining cause the heavy bleeding. Those on top of the bladder will cause urinary frequency. If they're in the back of the uterus, they can cause constipation. On the side walls, pelvic pain. So wherever they're located, that's where, and they can cause all of that, because usually women have more than one fibroid. They have multiple fibroids.
We have just a couple of minutes left. You've heard some deeply personal stories, and now you've got questions, Tony, particularly as it relates to the pain.
Yeah. I want to know if there's anything that can be done while experiencing the fibroid pain during pregnancy. Like, what can be done to alleviate that pain and won't be harmful to the child?
Right. It's kind of hard, to be honest with you, because during pregnancy at that point, we are worried about mommy and baby. We have two patients now that we have to worry about. A lot of times the type of medicine that we give is called endomethacin, or patients sometimes have to end up having opioids during the pregnancy for short periods of time, depending on how significant the pain is, because we can't go take out the fibroid or do anything about it with the pregnancy. Yeah.
Dr. Lipman, your thoughts?
No, exactly right. I mean, unfortunately, in pregnancy, the fibroids can be very difficult to manage. They grow rapidly sometimes, as it did with you, and so they outgrow its own blood supply, and it caused that degeneration, which is severe pain.
You both talked about in the break just how lifestyle outside of a pregnancy makes a difference as well. But for you, Tony, I know you also wanted to know, just can you carry?
Yeah. Can you go to full term while having the fibroids?
Many women
You
do.
both have had patients
Many
who...
women do.
Absolutely.
Absolutely. Some women, like yourself, actually will find out that they have fibroids during their pregnancy, and the baby and the fibroid live happily ever after and do very well together. It really depends on the location and how those fibroids grow, to Dr. Lipman's point, during the pregnancy.
There are lots of options. I wish we had an hour to go through, but if you both could just, give us just a sense, because Regina is wondering too, just from a perimenopause phase, what are the options? I know you don't have a particular...
Well, a lot of people have fibroids, particularly women of color who disproportionately suffer with these benign tumors. If you don't have any symptoms, you don't need to do any treatment option. But as they get to be a problem, then you get into the different options. You could try medicines, which don't work very well, either non-steroidal anti-inflammatory medicines like ibuprofen or tranexamic acid, or hormones like birth control. But birth control has estrogen, and estrogen makes fibroids grow. So that can be a problem. And then you get into the treatment options. There's the surgical options if you're interested in fertility, a myomectomy, or a hysterectomy if you're not. But we do a procedure that's completely non-surgical and outpatient called UFE, uterine fibroid embolization. 30-minute procedure, home the same day with a Band-Aid, keep all your parts, treat all your fibroids, even have children after, even covered by insurance.
So does that mean, and that's significant, right?
Right.
Whole different show in terms of
Right.
what ends up getting covered, right?
And they're showing pictures actually over.
Oh, yeah, we see. Yeah, our viewers are seeing those as well. This is a before and
This is a
after.
before and after a UFE. On the left, you can see a big fibroid, and then 6 months after her UFE, all of her symptoms are gone. You can see the difference. Her uterus is now normal in size. You can barely see where that fibroid was.
Yeah. And Dr. Hawkins, for you, I mean, that's...
Yeah. So I too, we do a actual shrinkage procedure called radiofrequency ablation. There's two types of Cessna Sonata where we don't even have to do any incisions on the abdomen at all, that we can go vaginally and shrink the fibroids using ultrasound and heat. And that way the fibroids can shrink, soften up actually. And again, patients can preserve their fertility if they'd like.
Let me ask you this just quickly with the time we have left, is what can keep them from coming back? Because that just seems like,
Well-
that's honestly why I had a hysterectomy, because I was just afraid they were going to keep coming back, just briefly from both of
Yeah,
them.
with UFE, it treats all the fibroids. So unlike some of the other options where you can only address some of the fibroids, UFE addresses all of them. In a sense, so does hysterectomy, but we do it without any surgery at all.
Unfortunately, fibroids can come back with any methodology, of course, short of hysterectomy. But the lifestyle modifications I express to my patients are super important. Cutting out red meats, really staying away from processed foods, soy products. Soy has a lot of estrogen in it, and soy is a
Interesting.
beautiful plant, but I'm going to eat it every day after menopause, but before menopause, we chill on the soy. And then things like decreasing our stress, and especially for melanated women, brown and black women, we should be taking vitamin D every day, because vitamin D is linked to
deficiency,
fibroid growth.
yeah.
Vitamin D is the most powerful
Absolutely.
growth inhibitor of fibroids that we know of. If you have a normal vitamin D, to Dr. Hawkins' point, you're much less likely to suffer with fibroids, but only 10% of women of color
Yeah.
have adequate vitamin D.
We are out of time, but I thank you for sharing your stories, ladies. First of all, your expertise, my physicians, and we'll just have to tackle this another episode.